So I wanted to talk a little bit about a clinical tool that I use to help people identify which supplements might or might not be helpful. There's a technique called nutrition response testing, and that is a protocol that I use to assess whether or not the body is under stress or strain, how well your nervous system is able to integrate your fight or flight response and your relax and repair response, and if we have any stressors in terms of like scars, immune stressors like bacterial, virus, parasitic, fungal, microbial type things, any dietary stressors that you have, any chemical stressors, any metal stressors. We can see if any of those are impeding the ability of your body, your organs, or your nervous system to work at their best output. Okay, sometimes we find that there is one system that's under a lot of stress or strain. And when that happens, a lot of your body's healing energy is accumulated to keeping that running as good as possible. I'll use an example in my own history. Some years ago, I fell and broke my leg, and it was really a long struggle for me to get my strength back and to fully recover. And it's not because I wasn't trying the right things, right? Like, I'm a chiropractor. I was getting adjusted. I was working with physical therapists. I was doing exercises. I was taking handfuls of supplements at the time, and none of it was really working. So I personally started working with a nutrition response testing practitioner. And when I went through my first protocol, the organ system that showed up as most stressed to me, oddly, was my tonsils. Now, what in the heck does that have to do with my knee? But when the practitioner told me that, it totally clicked, because 5 years before, I'd gone through a time of tremendous stress in my life, and I developed strep throat. And after having some antibiotics to treat the strep throat, it came back like 3 weeks later. And then I had more antibiotics. And then after that, I'd get the same like sore throat anytime I was under stress, white pocks on my tonsils, like bleh. But I would go in and have my throat culture, and pretty soon, like, it wasn't coming up as strep A or strep pyogenes anymore. So like, oh, it's not strep, it's viral. Just, go home, it'll go away. And I kind of went on like that for, like a few years, I think, of like this recurrent tonsillitis. And eventually it just got to a place where I wasn't having like fever and like full-blown illness. But if I went through a weekend where I didn't eat healthy food, I stayed up later than I should, or I was under a lot of stress, or kind of, burning the candle at both ends, I'd get a sore throat. So that was a weak link in my body. And when it was under a lot of stress, that built up imbalance of bacteria and microbes there would take over. And for me, that would be registered as a subclinical infection, right? Getting my throat culture at my MD, they're putting it on the agar plate, they're growing it in the thing, nothing happens. So it wasn't a clinical infection, they weren't finding it, but I had all the symptoms and signs of it, right? Like, I knew it wasn't well balanced. That was a perfect place. So when I started my regimen of supplements that I tested really strong for, that addressed my tonsil health, lo and behold, my knee started to feel better. It wasn't my tonsils that were making my knee sick. My tonsils were sick, and my body was working so hard to keep those functioning that it didn't care about repairing my knee. That was not a healing priority for my quantity of life, right? It was affecting my quality life, but my body just didn't have the reserves or the resources to repair it. And so I find when I have patients coming in, a lot of times, if we're doing all the right treatments, but none of them are really sticking, or they just feel sort of off, sometimes they have an organ system that's dealing with a stressor that just needs a little bit of extra support. And there's no labs necessarily that your MD might pull that can show that you need a medication. And therein is the perfect place for us to target things with some supplements. So if this is something that you think is interesting, you'd like to learn more about, I'd be happy to talk to you about it. If you're like, that's it, I need to do that, I just want to have a full body assessment, it takes about 45 minutes for us to do, and we focus just on that. And if you go to my scheduling window and you look, it'll say NRT assess initial intake, I think. That gives us that 45 minutes. And through that 45 minutes, we do a full protocol, checking strength in your muscles to see what your stressors are, and to see if there's any supplements I can recommend and at what dosages I think you need to get started to go on that healing journey, okay? So, and I think, I can't tell you off the top of my head what we charge for that session either, but it's all in our Jane scheduling software. So when you click on that appointment, that's not a service that insurance covers. It's strictly out of pocket. But for some of us, myself included, it can be a total game changer. So there in a nutshell is one of the clinical tools that I use to help provide recommendations on vitamins and supplements. And yeah, okay, bye.